Welcome, everybody, to the Cone of Shame Veterinary Podcast. I am your host, Dr. DrAndyRoark. Guys, happy Veterinary Technician Week. Gang, this is the time of the year when we celebrate our veterinary technicians who do so much work for us and so much for our patients and our clients, and who drive our practices and who give of themselves and who often do not get the credit they deserve for the care that they deliver. And so anyway, if you're a veterinary technician out there listening to this, thank you for what you do and happy Veterinary Technician Week. I am back today with my friend Tabitha Kucera, the veterinary technician specialist in behavior, and I am asking her about a case that I saw where the owner has got a new cat, and the new cat and the previous cat are not getting along. And she's asking me about how do I get them to get along. And so anyway, I had the idea for this episode when I was faced with this last week. And these are not easy cases. And I wanted to make sure that I was giving the best advice that I could, because I really don't want one of these cats to get kicked outdoors. That's kind of what the owners were talking about. And I don't want that to happen. And so anyway, Tabitha and I get into it, and it is a really good conversation. And I did some things right. And also there were some parts of my game that Tabitha thinks I could have done a little bit better. And we talk about that. And I'm okay with that. I started this podcast because I wanted to continue to grow and to be a better doctor. And so if I only had people on who were like, "You're doing great, Andy," one, that would not be true. And number two, it would not help me learn and get better. And that's what it's all about. So anyway, this is a really great episode. I really enjoy Tabitha. And she's got great insight. And I am a better doctor because we had this conversation. So let's get into it.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. DrAndyRoark.
Welcome to the podcast. Tabitha Kucera, thanks for being here, my friend.
Stoked to be here.
Oh, man, I always love having you on. For those who don't know you, you are the force behind Chirrups and Chatter, which is sort of a behavior consultancy. You do a lot of work with animal handling and training around animal handling for teams. You are a registered veterinary technician. You are a vet technician specialist in behavior. You are also a certified cat behavior consultant. You're a lecturer. You are a distance endurance runner. You are just a general force of nature is what you are. But you are one of my favorite people to talk behavior with, and that's saying a lot because I have a lot of great behavior friends that I love talking behavior with.
I'm honored.
You came into my head recently because just a couple of days ago, I had this conversation. It was one of those conversations where I think I did it right, but I also thought it's been a while since I've reviewed this, and I wonder if things have changed or if there's more updated advice than what I'm giving. And so I'm in the exam room, and there's this lady, and she's very nice, and she's got this 7-month-old Bengal kitten. And the kitten is exactly what you would think. It's 7 months old, so don't think small. It's a full-size, sleek, leopard-like cat. And he's into everything. He's up on the countertop. He's in the sink. He's swatting things off of the table. He's under the bench. He's back on top of the bench. And he's a really cool cat. Like, I really like this cat a lot. Great temperament. But he is an active 7-month-old guy that he didn't really like to be restrained that much. He just kind of wanted to get back on the floor. And life with him was really good, except there is a senior Maine Coon cat, so around 9 years old, Maine Coon cat back at the house. And Mom said to me, she was like, all right, so I got this kitten and I brought him in and he's been here for a couple of weeks and everything is good, except we put the Maine Coon cat like in another room and closed the door. And we we thought that we were sort of letting them, letting the new cat get used to the house and then we'd bring them together. She said, anyway, last night we let the Maine Coon cat out and it did not go well. The Bengal kitten chased him all around the house and out of the room. And my husband says, that's it. This young cat's going outside. And I don't want that to happen, is what she said. And so I thought, okay, there's always pressure. You know what I mean? I feel pressure to kind of get this right and to give them some guidance and give them a path. And so, I mean, I can tell you kind of what I recommend if you want to hear that and pick it apart, or if you'd like to just sort of take it and tell me how you start to look at these appointments. Either one I'm fine with. What I really want to kind of do is dive into how do you set this up in your mind What do I want to make sure that I'm not missing? And are there mistakes that are commonly made in the vet clinic? Are there new pieces of advice that maybe those of us who learned about inner cat aggression 10 years ago are not bringing to the table?
First off, I love that your client felt comfortable enough to bring that up to you and that you offered advice. And if you, to all my colleagues out there, if you aren't comfortable, because again, my background's behavior, nutrition, I know smarter people with that. If you are not comfortable with behavior, I much rather just have you not say any advice, but say that this is a common issue, maybe address like your cat's not spiteful, kind of address some of those common myths and then provide them with some resources because that is so powerful and prevents so much human and animal suffering. I know that's a deep statement, but so I have to give you a click treat for that. And the first thing, just based on that, because again, I'm always going to get more data, right? But based on that information, the first thing automatically, just letting the cats see each other in most cases, honestly, that's not going to go well. Okay. For a variety of reasons. Just like if some random dude walked into my house.
Yes, that makes sense.
Again, I use a lot of analogies. I understand a cat's a cat, you know, a human's a human. If a random human walks into my house, even like, let's say it's my neighbor, so I've seen them before, which in most cases, these cats probably haven't. Yeah. I might grab an item to hurt the person with. Sure. So first off, I think we need to be a little more kinder and kind of approaching the caregiver with that perspective, being like, oh, that must have been so scary and frustrating. So acknowledging their concerns, but also letting them know, like, this isn't just like a, hey, this is how it is. It's black and white, because unfortunately that's a common misconception. And kind of giving that analogy and explaining just one part of it is like one of the biggest reasons, unfortunately, I see more cat aggression than I'd ever need to see.
Do you think it's getting, are you seeing more cases now than you used to, or you feel like this has always been this level? Yeah. Has that changed at all?
Honestly, I think it's always been. I think there are the other challenges. There are not as many cat behavior professionals, which makes it challenging because there's less cat behavior credential paths. And of course, everyone's not going to do their VTS so there are some challenges that I recognize. And again, right, the internet, love, hate, but mostly dislike when it comes to behavior. Okay. So caregivers Google inner cat stuff. And one thing that I could tell that I would love for my colleagues never to say is never say, let them fight it out. Oh, yeah. No. And I hear that a lot, unfortunately.
Really? Just let them settle it is what you hear? Yeah, I did not say that.
I know.
Sighing a deep sigh. I did not say that.
I am not here to judge. I'm here to support. But that's something that I could flat out say, like, that is not okay to say. It's like inhumane, honestly. Okay. It's kind of a big statement. But so I think helping the caregiver recognize, hey, using that analogy and being like, here are the more appropriate steps, or maybe not use that word, but we need to do a gradual introduction.
Yeah, we got to do this slowly. Yep.
And usually if we do that proactively, which I'll be honest, in most cases, people don't, it's until there's already trauma, which we can still help. Yeah. But if caregivers just knew how to do it, which again, minimal resources, knew how to introduce gradually, appropriately, like once they get that other cat, that introduction can be a fairly short process. Because when there's no trauma, it's a little easier, as you can imagine, and it's more efficient. But a lot of people don't have that. They're like, we let them smell each other, and then the whole feeding them on the different sides of the door, that gets me. But that's because that's what they're doing their best. And even some of my colleagues might be like, that's what I tell them to do. But that's way too much. Because like feeding a cat on both sides, first off, we're adding visual, which if this is where body language comes in.
Wait, what do you mean when you say feeding them on both sides of the door? What is it? Sorry, what does that mean?
Oh, no, that's a really good question.
Say feeding them on both sides of the door. I'm like, is this one cat? And I feed it a little bit and then put it under the door and close the door and then feed it some more? Like two different bowls? Are they against the door? What's happening here?
No, this is good. What I commonly see, and again, what is prevalent Googling is you keep the new cat in like a safe space, separate area for usually like 1 to 7. I don't know where people get these numbers from. 1 to 7 days. So there's usually a time versus assessing the cat. There's just a daytime, like this many days. And then you have like a baby gate or two. or even sometimes you put a cat in a carrier, which another thing, this is something for my colleagues. You never have a cat put into like a small space, like a carrier or a playpen where they can't escape, and then have the other cat interact. Whoa. That's a no.
Did you see the video of the people inside the giant see-through cube and like the grizzly bear came and knocked it over? So it's kind of that, it's supposed to be a bear experience, but they're in this cube and this grizzly bear is attacking the cube. And that's what I imagine. I'm like, that's the level of stress that brings to my mind.
You have to send me that. I have to put that in my lecture.
I'll find it for you. It's the stuff of nightmares.
But no, that's kind of what it's like. So what I commonly see is then no one's basing it on individual cat, nothing else, or the other cat for that matter. Yeah. And then they get their food. So usually they're not even like extra meals, like they're AM, PM, like routine meals. And between these baby gates, they usually place the food pretty close to where the baby gate is and have them eat.
Yeah.
So that's something we call flooding, which is unfortunately a big part of what's on the internet for introducing cats. And flooding just means exposing a learner to what they're afraid of or uncomfortable with full force. So just because the cat's eating does not indicate that cat's comfortable.
Okay.
There's a lot of other body language that we need to consider, and that tends not to happen because people aren't aware. And then also it's kind of dark being like, you can only eat when you're around this thing you're uncomfortable around, which is...
Gotcha. Okay.
So it could cause some pretty big issues. But I'll be honest, that's what most people, because they're doing their best.
Yeah, that's the tools you've been given.
That is usually not, and if it does work out for you, it would have worked out either way. And it's because people will be like, but my cats, and I'm like, I'm not at your house, but I'm going to be honest, there's probably tension you're not recognizing, because usually people don't recognize tension until like Itchy and Scratchy Simpson's cat is like fighting, or there's actually like a physical injury. So that tension's been there for a long time.
It's that saying of something like 70% of the cases that we intervene in would have gotten better on their own if we had just left them alone. Like the animal would have worked it out and been okay without us.
And they do not get used to each other. Like that's not a thing. It just gets, like you said, understandably, the more you're exposed to something you're uncomfortable, whether you're a human or animal, your response becomes more intense, more fearful, more conflicted. And I work with a lot of cats who actually start self-segregating. Like, they're not even hanging out in their favorite places.
Yeah, they just kind of like, I mean, you say all the time with cats, is like, this cat's basically they stay upstairs and this cat stays downstairs. And the owner's like, it works, it's fine. But, you know, you have to sort of think about, like, we take that for granted, I think.
For sure.
Yeah, so let me circle back around to this door real quick. So you might have guessed it, there was a door involved in our conversation. Are you anti-door? Like the baby gates idea? Are you like, that's a terrible idea? Okay, so I was told years ago about, separating a new cat, and then they're on the side of the door, and then they can kind of interact with each other underneath the door if they so choose. There wasn't any food involved or anything like that. And the biggest thing I focused on in my advice to them was switching out blankets or things like that, trying to introduce smells and just sort of things of sort of a low, take it slow, let's keep the cat separated for now, start to change bedding and things like that around to try to let them get used to each other, try to greet each other underneath the door, things like that, but really not rushing this, and then starting to move towards maybe supervised time and things like that. But so are you anti-door overall, or is there a way to use the door effectively? And again, you can tell me I was wrong. Like, I'm here to learn. Like, that's why we do the podcast.
So I actually have my own protocol that I've created because...
Does it involve a door?
It does.
Okay, good. Oh, thank God. All right.
But that introduction, and this is where it's complex, Andy, right?
Okay.
So that introduction is one part, because that's the other thing. Most people focus on that part, but first things first, I need to identify each animal, like, because in many cases there's more than two, but each cat, and make sure their mental, physical, and social needs are being met. And what that means is, like, I need to address and rule out medical issues, because the amount of underlying medical issues that I see in my cat cases is very high. And if this cat has chronic pain or a generalized anxiety or something, again, we can go on and on, right? I need to address that first before I'm like, hey, it's really hard to learn and focus because you have chronic pain or chronic anxiety. Hey, I want you to learn and focus with this new animal. So I think first doing that. And then as far as social, mental, physical needs,
Okay.
enrichment, which is a buzzword, but like let this cat, which is a lot more than wand play and puzzle toys, but that's a good start. And then, meeting the cat's needs from an environmental standpoint, which thankfully this information, like the 5 pillars of a healthy feline environment, this information is getting more and more spread, which is beautiful. But are there enough resources? And in many cases, I'll be honest, like in my 10 years of consulting, I've never seen an appropriate litter box set up from the start. And to be fair, Andy, I did not have one either until I learned. So,
sure.
But literally, I've never seen one. Like
you would think that people would just luck into it, right? Like at some point, there's only so many places to put a litter. You're shaking your head no. Like, no.
Sorry, I'm just like, and by appropriate, I mean basic needs meeting feline friendly housing.
Tell me about appropriate litter box placement. Like, just give me the bullet points.
So quickly, so it's some of the things, or cat vets, they changed their name, have talked about that we might be familiar with. I think sometimes we say the things to caregivers, but we don't explain the why. So I get why they don't do it.
Sure.
But I have a bunch of handouts on my website actually going over these that are really easy, quick. But the biggest things are litter boxes should be accessible. So at minimum, there should be one on each floor, usually more.
Okay. Are we still doing one per cat plus one? Is that the math formula?
Yes. I'll be honest, not everyone does. I mean,
I know people don't do that. Trust me, I know that there are people who don't do that.
But I think as a good starting point, like, because I meet my human learners too, we work up to that.
Okay.
But I'm like one on each floor, but the one per cat plus one. But you have to clarify to your caregivers that 3 boxes within 5 feet of each other is one box.
That's one box. Gotcha.
Yeah. So a lot of caregivers, or all the boxes are in the basement.
Like I have a laundry room. It's got 8 cat boxes in it.
Like those laundry rooms, Andy, and those dang basements. Let's hide your, like, and then I tell the client, like, I want you to pee outside every time you have to go.
Yeah. No, I get it.
Just the way resources are set up too, because everyone's like territorial. And I'm not saying that isn't an appropriate term when we're doing research, but I am a language nerd. And I think people take that word. To me, I grew up with 3 siblings. And again, my brain wasn't fully formed because I was 15. But when there was one more Diet Coke in the fridge, I would resort to physical violence.
Yeah.
To get that. So these cats aren't territorial. There aren't, even if these cats were bonded, which there's a lot of underlying reasons why that tends not to happen. Lack of socialization, lots of stuff. But there aren't enough, of course there's going to be tension. Like I have one bathroom in my house. I live with a well-socialized human adult, and it has caused severe tension. Again, just if someone's like, I meet you on a plane, I tell people what I do for a living, I don't recommend it. Tabitha, give me 3 tips, 5 minutes, go. I say increase resources, and then I define briefly what a resource, because people think food and water. And I'm like,
when you say increase resources, I'm like, we're just going to feed the cats more? Is that what you're saying? Like
food, water, scratcher.
Like, look, I know this is stressful. Like, let's just chow down here until you guys get along with each other. And then I think about the friendships I've had in my life, and I'm like, that's a solid plan. Yeah.
So I think meeting their physical, social, mental needs, which I can unpack for hours, right? But that needs to happen first, because I deal with pretty severe cases of this. And to be honest, once I address those things, the introduction, it's still, behavior modification. It takes time and is complex. And I'm utilizing other management skills. Like I harness train and teach cats to go to a station or a mat and do lots of other things because management's always on my mind. But I've had a lot of success with the introduction protocol because I address each cat individually first. And I don't think that always, like you said, with this situation is common, Andy. A younger cat, even though old cats should play, and if they don't, data, anyways. But they most likely have different play styles.
Yes.
And also that kitten may have some like extra arousal, like Tabitha baseline energy. And that cat, it's like, I always joke with my clients and say like, you're 41 and that friend's like, let's go to just one more club. And you're like, dude, I'm not feeling this. And then you just start ignoring, you generalize that. And you start ignoring those friends' calls.
Yeah.
So I think a big part of it is, again, meeting their needs, which helps that Bengal a lot because I'm meeting their needs by giving them things to forage and hunt and have their excessive play. So those basic needs are met. So they're less likely, they're able to regulate their emotions and not immediately become aroused, which is another big step. But also, like, I'll be honest, if I hear 9-year-old, the first thing on my brain is like, the likelihood of pain is higher than the likelihood of not pain.
Yeah, smart.
And even if there isn't a chronic medical issue or underlying medical issue, like that, again, that friend that's running up to you with like Tabitha energy, like you're like, dude, you're a lot. We're going to start with maybe that Bengal cat at a distance. So I'm not opposed to the door technique. I do one sense at a time. So I do scent swapping, and I do it a little different than most people do, because again, like brushing cat, or like you just said, exchanging things, which I think is great. But a lot of the stuff is like brush cat, then brush this cat, or put this blanket on their favorite place. I think that's flooding again, because cats, we know, communicate via scent. So it's like the other cat being there. So I do it very differently. And I'm like, how can I control this? Because they can smell each other.
Sure.
And how can I utilize this in a structured way? I have my caregivers collect the scent with like a sock or something.
Okay.
And when the cats are exhibiting, because also in many cases, we're just spreading anxious and pheromones.
Yes, totally.
So I'm like, hey, I teach them what relaxed body language is. And as we work together, they get more and more skilled at that. But I let them know, and I'm like, when your cat's exhibiting relaxed body language and soliciting, doing that beautiful lean in, I want you to just rub their cheek, maybe their flank or shoulder, and then put that in a Ziploc bag and do that for 5 to 7 days. And then we have a concentrated scent, and then place it in the middle of the room, and don't put treats on it. Just pair it with good stuff.
Okay.
And I'll be honest, there are some cases where cats smell that other, and like their body language, they have 5 displacement behaviors. Or I had one cat who hid under a bed and didn't return to baseline for an hour. So we're going to have to break that relationship down more.
Gotcha.
But in many cases, it's just classical conditioning. Here's a concentrated set. This is a short session. I'm not forcing you to interact with it, and we're pairing it with good stuff.
Okay.
Then I do auditory, which is door play.
Gotcha. Okay.
And I do something called capturing. This is a quick rundown of this, where we capture natural behaviors. But the biggest thing is at each step, because then I do visual, which would be the baby gates. And then I do supervision, and then supervision longer and longer. But these sessions are 5 to 15 minutes. And I utilize each cat's non-stressful starting point. So for that Bengal, her non-stressful starting point is most likely at the door, actively playing with the toy.
Yes. Mm-hmm.
For that other cat, it may be under the bed, 10 feet away from the door. So I reinforce that cat where she is. And if she chooses to make any forward movement or slow blinks or stretches, I reinforce that. But I reinforce strategically. I'm not always reinforcing closer to the door. Sometimes I'm reinforcing for like her body shifting forward or her looking at the door, but I give it away from the door. So there is some complex behavior modification going on. But I think the biggest thing with the feeding by the doors is we can't do it right next to the door.
Mm-hmm. Right.
So we have to start at each cat's non-stressful starting point.
Gotcha.
And then, pair it with good things, which could be scent enrichment, play, verbal praise, petting, food. Food is just easiest for green trainers. And what I mean by that is new trainers. And then I would do supervision. And in that case, I have management. Again, we've taught this kitten already has emotional regulation, like behaviors that we've helped them learn throughout. And then this older cat is more confident through clicker training. I'm not going to say it's a simple process, but if you're a veterinarian or a technician or assistant in a room and you're like, hey, this is what's going on, I think the biggest thing in that minute or two is to say, oh, I understand how frustrating that could be. And then kind of like acknowledging some of these weird narratives that caregivers build. Like, I don't use the word victim or bully because there's no such thing.
Okay.
Each cat is struggling in a different way.
Gotcha.
And I've seen people like punishing, not that I use punishers.
No, I agree.
Yeah, anyways, because there's enough of those in the environment. And then body language, I think, is huge too for my colleagues. The amount of cats and getting more information. I love anti-anxiolytics, better living through chemistry, along with behavior mod and environmental enrichment. But there have been a lot of cases that I have experienced where I understand the caregiver goes to the vet and they're like, my cats are fighting. They're probably over thresholds because, to be fair, no one's listening to them. And people who are just telling them to like rehome the cat or let them fight it out. It's a bummer.
Yeah.
So the vet's like, oh gosh, I don't know what to do. And then they prescribe a medication for anxiety. And sometimes it's a situational medication.
Okay.
which may not be best. If we have more of a generalized anxiety, that's very different things. And also, we didn't get any more data to even identify if this is, because aggression's a normal communication tool. Like, for example, I totally understand why that Bengal and that Maine Coon interact. I could say why that didn't work out in 5 seconds.
Yeah.
And then I'll see videos of the cats and they were playing. Like, they weren't even. So I think just getting a little more information, meeting clients, empathizing with them. And then again, like what you said, like, hey, let's keep them separated and let's just slow it down a little bit. And then again, I use those analogies a lot because I think caregivers immediately resonate like, oh, dude. Or I'm like, I'm going to drop you in another country where it's not your known language. And you're a human that's well socialized. Most cats have lack of or negative socialization experiences. You're going to be severely stressed in that environment. So that's the other thing. I need that new cat to be comfortable with that space without that other cat before I start to even introduce the other cat. If that makes sense.
No, yeah, it does. It's always hard when you're talking to pet owners who have had the cats for weeks. You know what I mean? And they've kind of got a limited space and these things have been set up and you're kind of trying to sort out where we are. When you talk about anxiolytics, do you put feel away in that category? Are you a big feel away girl or are you not off that train?
So there's like calming aids, right? And that would be like a pheromone or playing white noise or classical music, right? Versus like an anti-anxiolytic, I would consider a medication that's prescribed.
You're going next level, I guess.
Yeah, but there are also nutraceuticals like calming care, Zilkine, Angstitane. Those are like a few of my favorites. But I'm not opposed to feel away. I don't think it hurts.
Yeah.
It's not usually because again, I'm aware that everyone has minimal time and resources. Yeah. And as someone that's been doing this for a long time, I rather have them create a comfortable environment in other ways. We can create a scent continuity community in other ways. So again, I'm not opposed to feel away at all. I definitely don't think it hurts.
Yeah.
But also I'm like, it's not in every single plan because I can have the caregivers purchase this instead, like not a pheromone. Because we don't really have much research on it. And then also there's so many like knockoffs and it gets really confusing, right? So I think, not that, again, I'm not opposed to feel away, but I would, if I was like my go-to 5 things, it's not even in my go-to 10.
Gotcha. Okay.
If that makes sense.
Yeah. No, it's good. That's good. That's good. That's good to know as well. Tabitha, one of the things that does make me feel good is now we have electronic medical records, and I send an email to basically every one of my clients as they're leaving. And one of the great things about email is that you can drop links in to share resources with them, and you have got a ton of resources on your website. Why don't you tell us about that a little bit?
Yeah, so I have tons because, again, I know what I can do, and I do feel like it's a responsibility of mine to provide evidence-based animal welfare positive resources and make behavior accessible to everybody. So I have a lot of free handouts that are like cartoons, very easy to read, 1 page. We're all humans. We all like that. For body language and pain and litter box setup. But also I have articles and podcasts and also the new inner cat tension guidelines from cat vets. Pretty good. You're never going to agree 100% with everything, but they're pretty awesome. And those are a good resource. They even have like a little cheat sheet. So I think another good thing you could do at your clinic is there's always at least one of you awesome people. You're all great that like behavior or love cats. There's always one of you. So let's empower that staff member and let's have them, like I have vet staff. I'm like, okay, let's do a common FAQ. Like the 5 things that you guys hear the complaints most about, because you can't cover everything. Let's get some people who are more skilled in that. So maybe this tech or vet goes to CE, like that I do about intercat, whatever it may be, and or obtains some textbooks and takes all that information and answers, just provides a few bullet points. And then every staff member has their own little spiel that you practice during a 5-minute staff meeting. Oh my gosh, now those people are empowered and confident and also realize people like me exist. Like many people don't even realize.
Oh, sure.
There are VTSs that are really advanced in cat behavior. And I think it's something that, again, you kind of feel stuck because you're like, I want to refer you, but I don't know who to or where to. So I think finding that information, like you said, Andy, providing links, and I understand everyone's not going to read links, but to be fair, these caregivers struggling, you just offering a little bit of, hey, that's frustrating. You're not alone. I can understand why that behavior happened. Here is some help. That is life-changing and amazing. And like, don't put so much pressure on yourself. But that will be a huge game changer for these animals and their caregivers.
Well, Tabitha, thanks so much for being here. I really appreciate your insight. Guys, thanks for tuning in, everybody. I hope you enjoyed it and got something out of it. Take care, gang. I'll talk to you later.
Bye, everybody.
And that's what I got. Guys, thanks for being here, everybody. Thanks for tuning in. Thanks to Tabitha for being here. I always love to do these How Do You Treat That episodes, and this is a good one. So anyway, I'm taking this back to the clinic. I hope you will as well. Gang, talk to you later on. Bye.